Okay, so let's talk about how you're gonna prepare yourself. Obviously, the diagnosis of cancer for you or your loved one, it's life-changing, it's overwhelming, and it can be emotionally difficult for anyone. So we need to get ready for it, and it's not a sprint, it's a marathon, and you're gonna go through it and come out the other end. So we need to get ready for it. So the first thing just is, let's plan strategy for how you're going to keep sane. So what that means is, I'm sure there have been times in your life when you've encountered difficult situations, but you have come out strong and you've come out the other end. So think about those times and think about how you got strength, what gave you strength, and how you came out the other end successful. So we are going to draw upon those strengths. So think about those. Think about what helps you to relax, what helps you to de-stress. So let's get those tools back in our life. And the third is, when we're going through a hard time, there are going to be days where we just feel like, okay, I can't take it anymore, it's just too much, and just break down and start crying. So let's plan for those days. Let's think about what you can do, who you can call, what you can do, so that you can get your strength back. Okay, so that's our first strategy. Now second is, we need to keep body and mind functioning and healthy to the best possible extent, right? So what I recommend for that is following a daily routine. So what is daily routine? Daily routine is basically an infrastructure for the day. So you remember when we were kids and we had a certain time that we had to go to bed, certain time we had to wake up, and we ate meals at certain times, right? So let's try to get that structure back in our day. So think about when you're going to eat. So make sure you're eating all your meals, breakfast, lunch, dinner, no skipping meals, trying to eat healthy. And then how you're going to get enough sleep or rest. So what time you're going to wake up, what time you're going to go to bed, and if you need a nap, when you're going to take a nap, and what kind of work you need to do. Okay, and allocate time for that, and a reasonable expectation of what's achievable. Okay, so let's talk about work then. So I'm sure you're thinking about, oh my god, I have so many things to do. It can be overwhelming and it can affect our emotions, right? So let's try and make a list of everything that needs to be done, and then let's try to break that list into smaller, more manageable tasks. So for example, could make a list for things I need to do around my house, what I need to do for my health, my job, finances, family. So let's try and make that list so that we have a plan. And then now of that list, I'm sure there are a lot of items on each list. Let's try to prioritize it, so you know what's most important and which one can be done later or can be scratched out. And also let's think about what can be delegated. So what items needs to be done right now, and which items can be delegated to somebody else, someone who can help us with those tasks, right? So in terms of delegation, of course, you have your family and friends who can help you. And over time I discovered few other resources to make my life a little bit easier, so let me share those with you. One is Amazon Subscribe and Save. So this is for any toiletries, household items. You can subscribe to them and Amazon will ship it to your house every few months, so that is available when you need it, and usually I found good prices. The other thing that's helpful was Google Checkout or Safeway delivery. So if someday you're feeling too tired to go get groceries or some item that you need same day, then you can look at Safeway home delivery or Google Checkout, and you select the items you want and they deliver it to your home same day. So that's another good option. The other thing is a service called Taskrabbit. So this is for any random thing you might need, like, oh, I need someone to babysit my dog, or I need dog food. So you put the task on Taskrabbit, and Taskrabbit has verified Taskrabbits who will bid for the task you have, and then you can have somebody do that task for you. And it's safe, reasonably safe, because Taskrabbit does background checks and they have ratings and things like that. So usually you can find some reliable people on it to help you with tasks. And of course, don't forget about Craigslist. So could use it for services like if you need help with cleaning the house or somebody for cooking, then that's a good service. You can find someone over there. Okay, and one thing to remember is you're not alone. I know that at times it might feel like it's so much and I'm alone in this, whether you're the patient or the caregiver. Just remember that there are lots and lots of people who love you, who care for you and want to be there to support you. So you have your team who is saying, go. We want you to be happy and we love you, right? So connect with your team. It'll help you, it'll help them. So how can we get some help? What can we connect? So think about emotional support. There are going to be days where you want to talk to somebody, so who you can call, who you can spend some time with, maybe get a cup of tea. And then your core family and friends, people who you feel like you can count on them and you feel comfortable asking about driving you for your treatment or helping you with picking up kids or cooking or some main items that you feel comfortable, you can ask someone. And then the other family and friends, also think about how you can spend time with them. And okay, so let's talk about tasks first. So you can think about which one of these tasks are really important for you and how they can help you. The other thing also to think about is think of when you need time alone and when you need company, because there are going to be days where you feel tired and you want to rest, and it's okay to tell your loved ones that I'm too tired to hang out right now and I want to get some rest, so you can recover and feel better. And also there might be days where you feel lonely. If you had a full life and now you are at home while getting your treatment, you might feel lonely. So think of how you can spend time with them and enjoy their company and feel loved and cared for. So either ways, it's okay. Take time to share how you're really feeling, and let people support you. Okay, and also don't forget that there are a lot of great cancer support communities, and these communities have a lot of resources that can help you. Also, they have other patients who are like you, so they're going through similar treatments and chemotherapy or surgery, so they can really understand how you feel, and you can understand how they feel. You can support each other. Okay, so with all these resources, you can be armed and prepared to have a wonderful treatment.